Just this week, health officials confirmed a skunk in South Abilene has tested positive for rabies. It's a situation every pet owner fears. So how do you protect your dogs from coming in contact with the virus? We're joined by Dr. Janice Price with the Windmill Animal Hospital, who has a few tips and just suggestions in general. This is a very scary thing to deal with, and you worked firsthand with this very case that we're talking about.
Yes, the dog in question that was exposed to the rabid skunk is one of my own patients. And what happened was the skunk got into the backyard, and the dog, being a dog, wanted to get the skunk out of the backyard, and the dog got thoroughly sprayed by the skunk. Animal control came and took the skunk and had it tested, and it tested positive. Fortunately, in this situation, my patient was properly vaccinated for rabies and current. We went ahead and boosted the rabies vaccine because of the exposure, and the dog is in an at-home confinement for the next 45 days. If his owners had not kept him up to date on his rabies vaccine, he would be in an enforced quarantine at the local pound for 45 days.
And that's because it takes symptoms a long time to actually show
several
up.
months to show up. The rabies virus, the way it works, it's in the saliva of the animal that has rabies, and it attaches to the nerves of the animal that gets bitten, and then it works its way up the nerve paths 1 to 3 millimeters per day. So like if a human gets bitten on the toe by a rabid animal, it may take 6 months before rabies shows up. But yes, rabies can go to people.
And that's the important thing to realize. This is not just dogs. It's dogs, cats, cows, horses. I mean, this is
any mammal, anything warm-blooded. That's why we vaccinate dogs and cats, to provide a barrier between us and the rabies out in the wild. Worst
case scenario, your dog does get bit by, for instance, a rabid skunk. What are some of the symptoms to watch for?
Well, rabies in dogs is usually called furious rabies, meaning, first of all, the dog has a change in mentation. He's not acting right. And then he'll have problems swallowing, so you will see the foaming at the mouth and the salivation and the drooling. And then he can start acting very aggressive and start biting odd things. Anytime you see a behavior change in your pets, it needs to be reported immediately to your veterinarian.
Okay, how do you prevent it from happening?
Vaccination. Vaccinate regularly as recommended, and also don't put food out for stray cats because wildlife comes into your backyard.
Okay, and how do you protect your backyard from these kind of animals getting into your yard? Is it possible?
Well, they also can come in for bird feeders. Wild animals come into your backyard because they're going after food. So if you don't put food out, then they generally will stay out because there's food elsewhere, such as in garbage cans and things like that.
Is this the first case you've dealt with recently in Abilene?
In Abilene, but when I was in practice in Dallas and Denton County, we dealt with it regularly because skunks are the natural reservoir for rabies in the wild, and Texas has lots and lots of skunks.
So where there's one, there's possibly more.
There's always more.
Okay, very good to know. Thank you so much, Dr.
My
Price.
pleasure.
We appreciate having you as always. If you have a sick little pet or you just want to know more about rabies, bring them into the Windmill Animal Hospital off Windmill Circle. The number to set up an appointment is on your screen. They're even open on Saturdays. All their information is also located on their Facebook page as well as bigcountryhomepage.com/KTAB-4U.